Hello everyone, welcome back to Med Classroom. In this video, we are going to talk about drug of choice. Drug of choice is a very important topic for FCPS Part 1 and it's related to pharmacology. So let's discuss important MCQs related to drug of choice. If a diabetic patient is also hypertensive, so the drug of choice is going to be captopril, which is an ACE inhibitor. If you want to control the blood pressure during an operation, then you have to give IV nitroglycerin. Eclampsia, the drug of choice is magnesium sulfate. The pregnancy-induced hypertension is by labetalol. It's treated by labetalol, and labetalol is a preferred option than hydralazine. Eclamptic patient on OT table, then you are going to give the IV hydralazine. Drug of choice for SVT, which is supraventricular tachycardia, is adenosine. We have another video for adenosine. You can watch that later. VT with increased heart rate with abnormal QRS complex. The drug of choice is amiodarone. Ventricular fibrillation. The drug of choice is lignocaine. Post-MI ventricular fibrillation is the drug of choice is lignocaine. Hypertrophic obstructive cardiomyopathy, beta blockers is a preferred option than verapamil. But if the option is not beta blockers, not given in the options, then you have to choose verapamil. Drug of choice in moderate to severe heart failure is captopril. So captopril is also the drug of choice in hypertensive and diabetic patient as well as in the moderate to severe heart failure. Drug of choice for partial seizures in adult is carbamazepine. However, in neonates, the drug of choice is phenobarbital. Myoclonic seizures, sodium valproate. Tonic-clonic scissors is sodium valproate as well as myoclonic scissor. Absent scissors is ethosuximide. So drugs related to thyroid hormone. In pregnancy, first trimester, you can give propyl thiouracil, whereas in second or third trimester, you have to give methimazole. For example, if there is an MCQ that which drug is the drug of choice in a 5-month pregnant woman, then you have that is the second trimester. So the answer is going to be methimazole. Drug of choice for hypothyroidism is levothyroxine. So if there is an option of if there is a keyword for clue cells, vaginal discharge, fishy smelly vaginal discharge, that is bacterial vaginosis, and the drug of choice is going to be metronidazole. UTI caused by pseudomonas. There is a whole scenario of this. The characteristic of pseudomonas were given. That is oxidase positive, non-lactose fermenting, green color and fruity smell. The drug of choice for the pseudomonas causing UTI is going to be ceftazidime. Swear or not responding to metronidazole. So into these two cases, if the word swear is mentioned, then you have to give vancomycin, right? And if it is not responding to metronidazole, the option is again going to be vancomycin. Choose vancomycin if metronidazole is not an option in normal case. So if there is a normal case, then you have to choose metronidazole. If there is no option of metronidazole, then you have to look for vancomycin. However, if there is a mention of swear word or it is not responding to metronidazole, then you have to choose vancomycin. Regime is going to be oral metronidazole is a first line for 10 to 14 days. For life-threatening condition, you have to give oral vancomycin along with the IV metronidazole. If option is given like vancomycin plus metronidazole, then you have to prefer it. No matter it's given it's oral or IV, you just have to choose that it's a both option. If there is just mention of the upper GIT bleed, that terlipressin is an option. GIT bleed, drug of choice is going to be injection octreotide. Injection octreotide is going to be a drug of choice for the GIT bleed. Chronic liver disease with upper GIT bleed management plan should be IV octreotide. Chronic liver disease presented with hematemesis, immediate treatment is injection octreotide. Traveler's diarrhea, the drug of choice is going to be norfloxacin more than the phenoxylate. So the answer is norfloxacin. Ulcerative colitis, drug of choice is sulfasalazine. Ulcerative colitis maintenance therapy is also sulfasalazine. Acute ulcerative colitis, the answer is going to be IV corticosteroid. However, the drug of choice for ulcerative colitis is sulfasalazine. Tinea solium pork worm infestation, the drug of choice is praziquantel. If there is tinea along with the schistosoma infection, then the drug is going to be again praziquantel. Tapeworm infestation, praziquantel. Drug of choice for tinea solium pork infestation with cysticercosis, the answer is going to be praziquantel. Acute pancreatitis, the answer is going to be pethidine. Some few drug of choice related to the reproductive tract. Drug of choice for endometriosis, that is medroxyprogesterone more than danazole. For hirsutism, the answer is going to be cyproterone acetate, which is anti-androgen. Drug of choice for carcinoma of breast in premenopausal women is tamoxifen, which is a agonist. Whereas drug of choice for carcinoma of breast in postmenopausal women is anastrozole. Anastrozole and tamoxifen. These are the two drugs that are used in carcinomas. In premenopausal women, tamoxifen is used, which is an agonist. In postmenopausal women, anastrozole is used. Raloxifene is another drug that is also used for the postmenopausal woman, and that is an antagonist of the receptor, right? So raloxifene is antagonist and tamoxifen is an agonist. Some related to infections. The drug of choice for gas gangrene is penicillin. Neisseria meningitis, penicillin G. Bacterial meningitis is ceftriaxone. gonorrhea, ceftriaxone, systemic fungal infection, amphotericin B, fungal sinusitis, amphotericin B, nasal or sinus infection, amphotericin B, B sting, swollen face with periorbital edema. That is going to be anaphylactic reaction, and that is IM adrenaline. Initial drug of choice for influenza virus is oseltamivir. Obsessive compulsive neurosis, clomipramine. About this point, thank you for listening. For more pharmacology videos, thank you.